Hello, and I have something to talk about right before my introduction. So, the intro to the introduction. Usually, when I sit down to do these videos, I do a little bit of testing first just to make sure the lighting is right, the levels are okay, make sure that the video looks fine. And when I sat down to do it, I looked at myself and I thought, wow, you look like you are going on safari or something. I have no idea what you're doing, Bliss. Looked at myself. I got a green hat on, a green Matthews hat. I got a billion Matthews hats. And then I have this vest, this nice fleece vest on. It's a little chilly in the house. So I had that on anyway. And it's kind of a green shade also. And I thought, boy, you look stunning. So I thought, why don't I just go all green? Because then I started to notice when I'm making my coffee, oh yeah, my coffee mug is also green. So I took it one step further. I thought, what the heck? I got a green watch. It's the one that I normally take out hunting with me. So I put that on as well. And normally I have a gray wedding band, one of these groove wedding bands, but I also have, yes, a green one. So I am going to put that one on too. I have no idea why I'm doing this. Mostly because when I do something, I like to take it up a notch or two or three. So that's exactly what I'm going to be doing with this video. Okay, let's get into chapter number 6. So this chapter is going to be athletic training and sports medicine. To start off with this is an important chapter for a lot of you because this is what a lot of you want to get into. This is why you went into exercise science. In fact, that's one of the main reasons. These fields are one of the main reasons why exercise science even exists at Wilmington. So it was, I don't know what year it was. It was within the past decade or so. The powers that be were the powers that be being the athletic training organizations started to look at what can we do to further the field. And one of the things that they decided on was that instead of having an undergraduate degree with a certification at the end of that 4-year degree, and then going straight into an athletic training career, there's going to need to be an extra step, kind of, in that we want some sort of graduate work. So masters of athletic training. And there would be no more undergraduate athletic training. Now, to do that, there needed to be some 4-year bachelor's degree to get into the master's program, wherever that master's program may be. The most common undergraduate degree would be exercise science, exercise physiology, kinesiology, any of the health fields, but there needs to be some sort of testing and prescription and biology and chemistry and some physics in it. And exercise science was the most popular one. It tends to be the one that fits the mold a little bit better. Now, there were some, at least from what I understand, there were some people talking about maybe bringing an exercise science program to Wilmington anyway. So there was some interest there, but the catalyst was the change from going from an undergraduate athletic training to a graduate athletic training is kind of what pushed it over the edge and said, yeah, we need to get an exercise science program in. So thus the exercise science program was born here at Wilmington. So that was kind of the main reason why we end up getting the exercise science program. Now it's now branched off into some other things. We can get into the occupational therapy program. From this, you don't have to do exercise science to get into occupational therapy. It's beneficial, but you don't necessarily need to. And then also physical therapy being a very popular field for students to want to get into is mostly contrived from an exercise science background. Not always, but mostly. So here we are, athletic training and sports medicine. So let's go ahead and dive a little bit into this and look at what these terms even mean, where you may be placed, what are some of the common areas they might work in under some of these names. So Without any further ado, let's get into the slides. Oh my goodness, the boring stuff, the slides. You don't have to look at big green me going on safari. Enjoy. Chapter number 6, Athletic Training and Sports Medicine. So what is athletic training? I always make the joke, and I know this is a joke, just please stay with me on this one. The first thing you're always going to see with athletic training, and the same thing with personal training to a certain extent, and strength and conditioning, is that the main goal is to try to prevent some sort of injury. I always say that that's kind of bad for business, isn't it? If athletic trainers are trying to prevent injuries, but again, it's just a joke. The thing is that is the main goal for athletic training, is to try to prevent the injuries from happening in the first place. You want healthy athletes. Now, if somebody does happen to get injured, and injuries will occur, it doesn't matter how well we protect the athletes, how well the training is, how well the precautions are, there are going to be some injuries that occur. That's just a simple fact of athletics. We're moving around. We could be hitting each other. We have non-contact injuries that can happen. It just happens throughout the course of a game or an event. So if it happens, knowing how to treat them immediately, basically being that first responder of isolating the injury, figuring out what is actually going on, how to actually treat it immediately. Do they need to be taken off the field immediately? What needs to happen right away? And then after that, once they are completely diagnosed and everything is figured out, what the injury actually is, coming up with rehabilitation processes after that to try to get the athletes back on the field and try to get them as close to 100% as possible. Now, some injuries, doesn't matter what you do, they're probably never going to be 100%. They're never going to be what they were before the injury. Sometimes they will be, and sometimes they potentially might be a little bit better, depending upon what the injury is and how the rehabilitation process actually went. Now, athletic trainers work closely with allied health professionals. They'll work with doctors, they'll work with physicians, they'll work with PTs, sometimes OTs to a certain extent. They might work with chiropractors. And they try to provide care to anyone who is injured because of participating in either physical activity or some sort of exercise. Now, an athletic trainer doesn't necessarily need to get into athletics. They don't need to be an athletic trainer in athletics. I know that sounds kind of weird, but as long as it's a physical activity or some sort of exercise, they can be hired to try to prevent the injuries, treat them, and rehabilitate the individuals after they have become injured. So, for instance, you could have athletic trainers at a rodeo. Of course, rodeo is a sport, and there's, again, another joke I always make is there's two types of people in this world. There's normal people, and then there's rodeo people. And that includes the riders and the clowns. Those are completely different types of people. But that is a pretty hectic sport. Fairly dangerous. There are a lot of major injuries that occur in a sport like that. Even dancing. Dancing is a physical activity. There are a lot of strains placed on the body and a lot of injuries that can happen. Obviously, mostly non-contact injuries, but there are injuries that do occur in something like that. So any type of plays or dance routines, there's going to be athletic trainers that could be involved in rehabilitating some injuries there as well. So what is sports medicine? So this describes various issues that are interrelated among medicine, the physical activity, exercise, the promotion of health, and also the prevention of disease development. So there's this balance between caring for competitive athletes and also treating patients who are more of the general public by promoting exercise habits and routines that will help to promote health and disease prevention for later on in life. Again, even if you look at that second bullet point down here, the treating of general patients, this is not just treating them if they do have an injury, but also promoting some best practices with exercise and health. So not just knowing how to treat injuries and identify and treat injuries and rehabilitate them, but also how to be able to communicate with individuals on a personal level and possibly even a team level, and communicate with coaches, communicate with parents sometimes on how to actually practice properly, practice safely, how to do some exercises properly. And then also in a team setting, going back to the competitive athletes, one story that I'll give with athletic training is that back in my day, which I always say was the 1800s, but it was the late 90s, early 2000s. And there was a drill in football that we did a lot. And a lot of schools did it. And some schools maybe still do it to a certain extent, maybe have like a very fractured sense of what this drill actually is, but it is known as bull in the ring. It used to be a complete circle where the team would basically get in a huge circle. There would be one player in the middle, and sometimes people would call it a name. They might call it a number. So a coach would do that. And the person in the middle had to be possibly aware of where the other person was coming from. So if that other person's number was called, they had to be on their toes and their head on a swivel so that they can accept the hit from that person and withstand the hit. And if they didn't, they got blindsided, pure and simple. It didn't matter. There was no true safety in this drill. It was seen as kind of a hyper macho type of thing, where see who was reactory towards this, who had some sense of place, who had an awareness around them, but at the same time there was lots of people getting injured from it. Not just injuries of maybe a leg or got the wind knocked out of them or maybe a shoulder. We're talking about concussions and severe whiplash a lot of times. So that drill ended up being cut down. It's normally, when it's performed now, it's normally a semicircle and the players are coming at you from the front. So we have changed some of that. And a lot of that was because of the athletic trainers that were saying, this is stupid. I'm having all these players coming in with either concussions or they're having other injuries that are nonsensical. This is practice. This is a drill. This should not be going on. These are way too serious of injuries to be occurring during practice. So some of that ended up being out of practice a lot of times because of athletic trainers actually spoke up and said, hey, no, this is what you need to do, because this can't go on any further. And not just athletic trainers, but the sports medicine professionals in the field got together and pretty much put out studies and warnings to a lot of the coaches explaining why this is not the best practice. Now, when you see something like this, it's not necessarily a something you need to worry about and like, oh my goodness, the sky is falling. No, it's just simply pointing out the statistics and the facts about the injuries and the injury rates and why it's important to have athletic trainers and people who know how to treat the injuries, how to recognize the injuries, and also rehabilitate the athletes. Because if you look at all these sports, common sports, there are a certain number of injuries per 1,000 people, either practice or games. Now, games, there does tend to be a little bit more injuries because the adrenaline's going. People are maybe running a little bit faster. They're going a little more full tilt during the games. Sometimes there could be some animosity between teams, and that could have something to do with it as well. But if you look at it, football, wrestling, hockey, men's soccer, men's basketball, women's soccer, women's gymnastics, women's ice hockey, women's field hockey, and then women's basketball. Again, not end all be all of all the sports that we have, but it does show the injuries during the game versus during practice. And you can see that they are pretty high, especially with the first three there, men's football, wrestling, and then also ice hockey. So there are a good portion of injuries that occur within those sports. And it's obviously important to have athletic trainers on hand to recognize and treat the injuries, rehabilitate the athletes afterward, but also to keep everyone in check as well, and to try to prevent the injuries as much as possible, to tape them up, give them braces, actual braces on their knees or ankles or wherever it may be, providing protective devices, making sure there's enough air in the helmets, and make sure the pads fit correctly and all this and that. So, and some recent influences with all the fields that we've talked about this semester and that we will continue to talk about. All of them are going to have their own association and professional organizations to become a part of. There was the formation of the National Athletic Trainers Association, or NADA. They are going to put forth the requirements that are necessary in the field for the education, and they were a huge part of actually bringing forth the graduate work. And along with these organizations, a lot of times there's going to be some certifications that they come up with to make sure that everybody in the field is who they are, or who is who they say they are, so that the degree that you have is accredited, but also the certifications can be taken once you have that degree from an accredited college, an accredited program. So the certification is absolutely necessary for athletic trainers, and has been for years. You cannot perform the athletic training without that certification. And the same thing is going to happen once you get to the graduate work as well. Now, the graduate work is going to actually require a little bit more. In fact, some more recent influences, and going back a little more into detail about the graduate work, they really wanted the athletic trainers to really be a first responder and somebody that could actually work a little bit more with some of the athletes. So things like setting casts, possibly doing blood draws, actually playing with the needles, being that phlebotomist if they need some blood samples, and also possibly helping with medication. So there's some additional things that they need to be able to do, and a lot of that required graduate coursework. And that's one of the main reasons that they were shifting towards that graduate work instead of keeping it at the undergraduate level. And some of the primary responsibilities of an athletic trainer, the prevention of athletic injuries. Again, I talked about that. It's bad for business, but it's the best for business. It is the best practice within athletic training, is that you prevent the injuries as best as you can. Again, you cannot prevent all the injuries. Doesn't matter what the equipment is, how great the equipment is, how space aged it is, what all the protocols are. There are going to be injuries because this is athletics and people moving around in space, and they are going to get injured. Now, there are pre-participation physical examinations, and that's going to be one requirement of an athletic trainer, is to do that physical prior to participating in that sport, so that they make sure that there is no obvious underlying condition. And in the case of COVID, you have to do a lot of the testing for COVID. When I was going into the athletic training room, usually that's how I go into my office. Within the past year, I've seen dozens and dozens of tests, and I know that's just a very small fraction of the tests that were performed. I mean, we're talking about hundreds, well, possibly even thousands of tests that were run within our clinic over the course of a year. It's amazing. But those are all the athletic trainers that are doing that are a vital piece of that puzzle, making sure the athletes are safe and they're not transmitting the disease, and also so that we can get the players out on the field and practice, but also to play the game as well. So being aware of physical, environmental, and practice conditions that could cause an injury. This is what I was going back to, kind of that bull in the ring scenario, and that drill that was a little bit too dangerous and was causing way too many injuries. Again, now it's still probably there, and it's still practiced in some of the teams, but it's not what it used to be. It used to be literally a very tight circle, and you had fractions of a second to react to where that player was coming from. And again, you can get blindsided, and there was some major injuries from that. Also, recognition, evaluation, and assessment of athletic injuries. You need to be able to recognize what the injury is, or possibly what the injury is. You have to know what joints, what muscles, what ligaments, tendons, what all is involved in the injury. And then that's part of the evaluation. Then going into the assessment of the athletic injury. How extreme is it? Is it mild? Is it severe? Do they need to get x-rays? Do they need to get an MRI? Those are some of the things you can recommend then moving forward. And again, reiterating that immediate care of athletic injuries, they are essentially the first responders out on the field or the court or the mat when the athlete is injured. So the treatment, the rehab, and reconditioning of the injuries. So any type of exercise activities that can be done to help to rehabilitate the athlete, then also any type of therapeutic modalities, ice, heat, could be massage, could be chiropractic medicine, could be whatever it might be, any type of creams, ointments. So what are those therapeutic modalities that could get the athlete back on the field in close to 100%, if not 100% of what they were prior to the injury? Some other responsibilities of athletic trainers, part of the organization and administration, there is that professional development and responsibility, making sure that you're up on your certification and up on the new science that is out within the field, and learning the journals and reading through the journals and making sure that the modalities that you're employing, as well as the exercise routines and therapeutic modalities, are up to snuff and have been vetted. Providing any coverage for sports and athletics when necessary. One thing too, if you know anything about athletic training, it's just not you show up at the game most of the time. It's just not you show up at the game and then as soon as say a football game, show up in, a couple minutes before the first quarter. And then once the fourth quarter ends, you go home. That's not it. In fact, and I was not an athletic trainer, but from the athletic trainers that I know, and they talked about this, if it's a 7:00 game, say on a Friday night for high school football, you're there possibly 2, 3 in the afternoon. You're starting to prep some of the athletes. You're taping them, going through maybe some stretching routines, whatever it might be. And then you were there throughout the game. And then even after the game, you might be there for a couple hours because you might be treating some injuries. You might be doing some paperwork afterward. If there was maybe a major injury or other injuries that occurred, cleanup. So there's a lot there. There's a lot of time that is dedicated to this. So you need to provide the coverage for that as well. So it's just not, you just show up and then you leave as soon as the game is over. And then any legal and insurance issues that can come up, it doesn't necessarily you need to be a lawyer or be an insurance agent, but you need to have some background in what are the legal aspects of the injuries and some of the practices that are taking place. And then also insurance questions that parents may have, athletes may have. You need to be able to have a little bit of background in that and at least understand some of the processes about going forth and figuring out who to bill. Then also working with a team physician. Not every high school is going to have a team physician, and not every sport and not every placement is going to have a team physician, but working closely with some sort of physician if they are there. Then also if it's an individual that has a doctor or physician or an orthopedic surgeon, working closely with them as well to make sure that you're both on the same page so that there's no conflicting exercise routines or modalities that are taking place. Switching gears a little bit, let's go into maybe a couple different injuries here towards the end that are very common, fairly common within athletic training in the sports world, really. ACL injuries, the anterior cruciate ligament. This is one that you probably hear about a lot. You may have even torn an ACL or possibly both of them, possibly even multiple times. It's a fairly common injury. It can be contact or non-contact injury. There are some aspects of it too that we'll get into. Some people may be at greater risk for tearing an ACL. But one of the most fantastical phenomenon that has occurred within the past, even just in my lifetime. I remember back when I was a young boy, when I was a young lad, when I heard somebody got an ACL injury, they tore their ACL, it was almost like a death sentence in terms of their career in sports or their career in maybe that particular sport. So if a football player got an ACL injury, again, it may not have been they were never going to be able to play football again, but they were never going to be anywhere near as good as what they were, or they were just going to be done. Now, that's not the case. Now they can come back a little bit quicker. The surgeries have gotten better. The therapeutic modalities have gotten better. The exercises for rehabilitation have gotten much, much better. The medicine just overall has just gotten much better to be able to repair that injury and that ligament and then get the players back on the field much quicker. Again, they cannot be 100% of what they were before, generally speaking, but they get pretty close to it. So that's definitely an advancement that we've had in the past few decades. That's been a great, great thing for pretty much all athletes. I can't think of any sport that would have a situation or have the just built into the to the core of the sport where you couldn't have an ACL injury. Anything that where you're up walking around, possibly going to have some sort of ACL injuries at some point somewhere. Even something maybe as simple as jogging. If you step the wrong way, it could happen. That's just the nature of the beast. So with ACL injuries, one of the fascinating things is that females do tend to have a higher incidence of ACL injuries, and it has to do mostly with the Q angle of the hips down to the knees. So the angle, the hips in the females tend to be a little bit wider obviously for childbearing purposes. And then there's more of an angle down towards the knees. And that puts a little bit more placement and a little bit more stress on the ACL, especially in certain types of running and cutting during certain athletic events. And sometimes if anyone who is landing and they have more of an internal rotation of their toes, that could also induce the likelihood of at least promote more of a risk for ACL injuries. Now, even though this statement here on the slide, it says reasons for the different rates of injury are unclear, we do know that that joint angle and that Q angle going from the hip down to the knees, that is one cause of it, or at least one cause of it. There could be potentially an increase in joint laxity to where there could be a little bit more of a mobility within the joints, possibly with some females, but also the muscular strength could play a role in it because females do tend to have less muscle mass. So that could play a role in not stabilizing the knee nearly as well as males. But it probably has more to do with the angle. And then also depending upon the female, and you can see this in males too, individuals who are internally rotating, like I said, internally rotating their toes when they land, that tends to increase the likelihood of an ACL injury as well. Now, one injury that has increased, at least in the honesty category, is concussions. One misconception, at least I believe this is a misconception from the data that I have seen, is that concussions are an increasing phenomenon. But they're probably not. The likelihood that we just suddenly, 10, 15 years ago, seen a massive increase in concussions was because players are getting bigger, faster, stronger. Players are getting bigger, possibly faster, maybe a little stronger. But there's probably no increase in the absolute number of concussions. However, there is probably an increase in the number of athletes who are honest about having a concussion. And also we have an increase in the ability to honestly step back and say, that person doesn't look right. If they get up and look a little bit woozy and maybe stumble a little bit, or if you see a hit now, say in football field, and you say, that doesn't look good, that person needs to come out, we need to test them. That's increased. The testing has increased. The testing has gone better. The other thing that's happened is a cultural change in that somebody is not bound by the rules of, again, machoism. I brought that up earlier, but it is, they are more aware of the fact that a concussion is a very serious injury. Yes, it's internal. You might not see it. It's not like a broken bone, like your femur sticking out of your leg, or an ankle that is completely in the opposite direction. But it is just as severe, if not more severe and more serious than a broken leg. A broken leg can heal and you can live the rest of your life, even if it's grows a little bit different or doesn't heal correctly, you can still live a good life. If the brain does not heal and the brain continuously gets injured, you cannot live a normal life, just the way it is. And that continuous bashing of the brain and the brain cells, that is what leads to CTE, or chronic traumatic encephalopathy. If you ever seen the movie Concussion, some of that obviously had some Hollywoodness to it. I don't know if that's a word, but they had some poetic license for some of that. Some of the stuff did occur, some of it didn't occur, but there's actually a good portion of it, and you can look some of it up online where it did occur. Especially some of the things with what Mike Webster had done, super gluing his teeth back in. He was tasing himself so he can get to sleep. It was, crazy stuff. But these are the things that happen. Some of the things that happen in the extreme cases of CTE. And we see some athletes who have had CTE, who do commit suicide. It's a very serious condition. And the athletic trainer and the sports medicine team are a very important and vital role in minimizing, trying to prevent them. This is the one, if you want to prevent an injury, this is the one to prevent. Because once the brain is injured, it's tough for it to heal. The only way for it to heal is you don't do anything with it. And whether or not it actually fully heals to begin with, we have really no idea. I mean, there still could be some damage even after one concussion. But even if it does heal, how long does it actually take? I think I've brought the story up before about, I was at a conference and a lady was actually, part of her research was actually looking at CTE or looking at concussions. There was a certain enzyme that was released that they were looking at. And they were finding that this enzyme was elevated months after the initial concussion. Now, they were doing this on rats, I believe. But I don't know if that's going to translate to humans. But if it does, if that's the case, if it takes 3, 4, 5 months, 6 months, whatever, for the brain to actually completely heal, this enzyme was an indicator of that it healed. So if it was elevated, the brain was essentially healing itself. And that was indicative of this increase in the enzyme concentration. So what does that mean? That would mean in the future, if somebody gets a concussion on day one of practice, they are out the entire season. It's not a week, 2 weeks, depending upon what their pre and post tests are. They just measure the enzyme. And it doesn't matter how well they can do. They could solve algebraic equations a month later and like, no, I'm fine. I'd be like, nope, your enzyme is still elevated. That's the important part of this. You start to get into some social things surrounding CTE as well, and in terms of the athletics, and sometimes you have two camps where, these are sports that are going to be an increased risk for concussions. Just let them play. Doesn't matter. You've already, wussified football. And then you have the other camp like, wait a minute. This is just football. Yes, it is important. It is a fun sport to play. I played it myself, but it is just football. It is just a game. There are other lessons that we can learn other than just giving ourselves concussions all the time, or getting our bell rung is what we used to call it. And I brought up the story when I was in high school. We had no idea about this. And when you get a concussion, you aren't out a week or 2 weeks. In fact, the coaches looked down upon that. I had coaches, just truth be told, I had coaches that if you went out because you got your bell rung for more than maybe a couple plays, they basically set your ass on the bench. And some of them almost held a grudge against you because, you just got your bell rung and you're out. This is where we were. But now we have the evidence to show that, no, this is serious. This is absolutely serious. And this is an important point moving forward in athletic training and sports medicine. How do we prevent this even further? We've come a long ways in the past decade and decade and a half. Come a long ways with the tests and the procedures that are necessary to try to prevent this. Some of the rule changes in some of the sports. But there are other steps too of trying to figure out, even if somebody gets concussion, which you can have, again, all the protocols in place as much as possible, but people are still going to get concussed. Just kind of the nature of the game. And sometimes we just have to accept that. If we want to continue some of these sports, we're just going to have to accept that some people are going to get concussed. How do we treat it afterwards? And we're doing a much better job at treating it afterward than we were before. And athletic trainers and sports medicine professionals are part of that. They are a huge, huge part of that and have been for a while. So what can we do moving forward? Are there certain other exercises, certain modalities? Are there medicines that we can come up with? So on the chemistry side of things, can we come up with something to help the brain heal much quicker? And what are some of the long-term effects of that as well? The problem with CTE is that it cannot be diagnosed while somebody's alive. It can only be diagnosed after the fact. And that's the sad part of this condition, is that somebody can have all these concussions that are built up over time. And that's really how it happens, is that it's usually not one concussion or two or three. It's you get a concussion, the brain doesn't heal, you get another one. The brain doesn't heal, you get another one. The brain does not heal, you get another one. And then over and over and over again. The brain doesn't have time to heal. And we're not talking about like a dozen or so concussions. We're talking about people who have had major concussions and have not had any time in between, or have had very small concussions over the course of a career. We're talking about hundreds, if not thousands, of head smacks that have these funny, tiny little concussions that have eventually led to this. And that's probably what happened to a lot of the football players that have kind of shown signs of CTE or have been diagnosed with it after they have been after the autopsy has been performed. So again, a very serious condition that the athletic trainers and sports medicine professionals are going to be on the forefront with moving forward. And again, have been, but they are certainly going to be now, especially with athletic training going to a master's degree. That opens up a whole nother area to where the athletic trainers can really start to study actual studies, scientific studies of how to prevent them, but also treat them in the future. So if you're kind of wondering, the last slide there, figure 611, was the concussions, kind of give a little bit of a visual, even though it's a static visual of what's actually happening. So the brain is essentially sloshing around in this fluid space inside of the skull. And that's the problem. It just goes back and forth and just keeps getting battered. And that's causing contusions. And that's causing injuries within the brain. And that's the problem. That's the major problem that's occurring. And there's no way to, get a brain transplant. There's no way to just take out some of the tissue and let it regrow. It's all we have, at least up to this point. We have not become scientifically advanced. Maybe in 1,000 years or 100 years, maybe 1,000,000 years, it's going to take for us to be able to replicate the brain and to be able to do a brain transplant or whatever it might be. But we simply cannot do it now. So that's the one that we have, and we have to take care of it. And if we can prevent some of these injuries from occurring from the beginning, that's the important part. All right. So that was chapter number 6. I've got my coffee here and all my green attire, and I am ready to go for the conclusion. So this is an important chapter for a lot of you, or an important topic. I was talking about these chapters like this is the best chapter. This is the best chapter. No, this is the best chapter. I feel like I'm talking about that throughout all of them. I enjoy the whole aspect of the field. It's why I like teaching this class. I love teaching in this field, is because all these different little tidbits of information And for me, athletic training is something I didn't go into. I'm not an athletic trainer. I always make the joke too. I make a lot of jokes, but I make the joke that if you have an injury, you probably shouldn't come to me because I'm not the best person to treat you and have you do any type of rehabilitation, because I have absolutely no idea. I'm not certified, for one thing, but I really have no idea how to do it. Like if your tibia was sticking out of your leg, I'd just be like, I got some duct tape in the truck. That's no, I wouldn't go that far. I would actually probably do something. Maybe take a picture first. That seems to be what a lot of people do, at least on social media. Anyway, that's what I've learned from society. But I would certainly know at least a little bit. I know enough to be dangerous. But this field, when I look into specific fields of this within exercise science, it piques my interest because it's something that is uncommon to me in my daily life and my background. So I enjoy learning about this. But for you, you could be learning this because this is what you want to go into. And I just try to go over the basics of it. I don't want to go into some of the very nitty-gritty specifics of it, because I would want somebody who is in athletic training or the sports medicine field to speak about some of those other topics. And I have had them in the past come in and talk about some of the specifics in the field and some of the placements, but you'll get that anyway. Once you get through the program, especially in the field experience courses, you will certainly have exposure to athletic trainers, and they will be teaching you some of those nitty-gritty specifics about the field, some of the ins and outs. So, sorry about the rant on concussions. I always go on. I always try to hit on the point about concussions because in my lifetime, it has completely shifted. Again, it was, I graduated high school in 2002. Even at that point, I think it was right around that point where in 2002, well, it was 2001 when we had our football season. There were times where I know some of my teammates had concussions. I got a concussion in practice one day. I know it was a concussion. Me and another teammate, one of my best friends, we just slammed together. Our helmets hit so dang hard. I just took my helmet off and threw it because my head felt like it was going to burst at that moment. And I just kind of fell down on my knees, and we both were concussed. So I know I've had concussions. It might explain some of this going on up here and some of my quirkiness, but even then, even the athletic trainer didn't think it was that big of a deal. He would just look at us and ask us, how many fingers are you holding up? And I couldn't tell that anyway. And, they'd ask us stuff like, when's your birthday? And they'll ask some of these, simple questions that you should be able to answer. The thing is, that probably wasn't the best diagnosis. And unless you were completely knocked out, you would probably be able to answer those questions anyway. But I knew that we had concussions. I knew it. I absolutely knew it. And I knew that I had some previously. But I remember the year after, when I went back to watch a couple football games, a year after I graduated high school, I remember there was two athletes that were on the sidelines, two my friends actually. And I asked somebody, I'm like, what happened to them? I didn't see them limping, didn't see their arm in a brace. And they said they have concussion and they have to be out for 2 weeks. And I remember thinking, that's stupid. That's kind of dumb. Even in my mind, that was ridiculous. That's what we all thought. So there was a change, at least in my situation, my high school from 2002 to 2003, somewhere in there, or basically fall of 2001 to fall of 2002, excuse me. Somewhere in there was a change in the protocols, and that if somebody was concussed, they had to stay out for 2 weeks. There was no questions asked. And even me, somebody who was interested in science and somebody who was actually going to undergraduate school for a science field, thought that it was BS. And thank goodness we are allowed to change our opinions based upon the facts that are given upon us. And the facts that are given upon us is that this is a serious issue. And I had to change my thinking once I learned that. Now, some of the hard sciences around concussions, I didn't see till years later. So I am aware of it now that I was just ignorant to some of the facts. So again, that machoism that is ingrained in us sometimes. It sucks to tell somebody I can't play. Well, where's your injury? Well, it's inside of my head. That's a hard thing to do. If you can't physically see the injury, that's a very strange thing. And your ego can sometimes get to you and prevent you from doing that. And that's what happened to us most of the time. There was a lot of pushback in the NFL. But again, these doctors, the people that were the experts in sports medicine, the athletic trainers, they pushed for this stuff. They pushed for the protocols and they got it. Thank goodness they got it. We have finally moved forward and we are continuously moving forward. If there's a new protocol that comes up that is showing more promise, I'm sure that's going to be on the forefront and that's what's going to be used instead of some of the old protocols. That's how we do science. We in with the old, or in with the new, out with the old. Excuse me. Sometimes that could be in with the old, depending upon what the research actually showing, I guess. But anyway, sometimes I go off on a little bit of rant there, but I guess I have at least some of the freedom to do it. Maybe this is my house, literally my house, and this is my class. So. I like to tell those stories because I know that the more I teach, the longer I teach, most of you probably weren't even born when I graduated high school. A lot of you might not have been born when I graduated high school. So you don't know that time. You don't know a time when, if someone got a concussion, or you may not know this time, someone got a concussion and it was like, so just get back out there. Right? Take a play or two off and then get the hell back in there. You may have had some coaches that maybe had some of that mentality, but most of the coaches now recognize that it is a very, very serious issue, and especially the athletic trainers know that's a very, 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 very serious issue. So anyway, I'm going to just go ahead and end it there. That's probably about enough for this chapter. So athletic training and sports medicine. And I thank you and I bid you adieu. Thanks for watching.